Yes.
Welcome again.
Yep.
Pensacola, good to see you. Here's a line from your executive order. Studies have shown that children are at a low risk of contracting a serious illness due to COVID-19 and do not play a significant role in the spread of the virus. But here in Northwest Florida, Governor, right now there are children in area hospitals who have COVID. We have confirmed it. We know some of those kids right now are on ventilators. So given that, what can you say to parents as school starts this week here about keeping kids safe from COVID?
Well,
schools?
Everything in that is 100% true. They are at low risk. If you look at the whole pandemic, however many people were hospitalized in the state of Florida at any given time, between 1.1 and 1.4% of that were children. So the overwhelming majority, 98+%. Right now, it's 1.3% of all the hospitalizations. Now, what I would also say is we've had a wave of RSV throughout the country. That is putting more kids in the hospital than COVID. That's a very significant risk, much more riskier than COVID. I would also say, based on surveys of hospitals, between 25 and 40% of all COVID-positive pediatric patients are incidentally positive. In other words, they're being treated for something other than COVID, and they're in and happen to test positive because they test everyone that goes through. So there's not been any change in how this impacts kids. It doesn't mean that theoretically it can't. And I think if you look throughout the country, if you look at the under 18 kids who have died with COVID, the vast majority of those had really, really significant health issues. You have people that have leukemia, you have people that have really sad things, and it's a tragic situation. But the notion, and we went through this last year with the schools. When we pushed to open schools, people said that this was going to be something that was going to be very problematic for kids. It turned out that was not the case. And actually, the schools, they're less likely to get it in school, believe it or not, than at home. And the reason is because what that statement said is also verified. You have very few instances of a student infecting an adult. It's almost always the adult infecting the minor. And that's been true throughout the whole pandemic. We haven't really seen any changes to that. And so, I would tell parents, I mean, obviously, your kids. That's the whole thing with the parents making the choice on the masks. And so I think each one's going to be different in terms of how they look at stuff. But I can tell you, we've not seen any material change in how this works. Now, obviously, we have more people hospitalized today that are COVID positive than we did 6 weeks ago. I mean, we're in the midst of a wave. And so you're going to see more of every age group, but the percentage of minors has not increased with Delta or with this thing. And I think that's interesting because if you think about it, we have 80% of 50 and over that are vaccinated in Florida. And that's the group that has the highest percentage of hospitalizations typically. So you would think that potentially the kids would make up more of a percentage because they're obviously not eligible for the vaccine, but they're still about 1.3%. And here's something else. An unvaccinated kindergartner is at less risk for COVID than a vaccinated 30-year-old staff member. And that's been true in the data. Now, the 30-year-old staff member is low risk and for serious illness as well once they're vaccinated. So I think that we had a great school year. I think we'll do it again. This wave last summer, we peaked earlier in July. Now we're into August, and so it's running up more on the school year. But at the same time, I mean, I think that kids have been out doing a bunch of stuff the whole time anyways. And so I think it is not a kid's disease, fortunately. It doesn't mean you can't find one example. But I would say in almost all of those examples, there's usually other aggravating factors that are present. And certainly for pediatrics, I think the RSV wave has been much more threatening to minors than the COVID has.
Governor.